Hello and welcome to the NutriMedicine webinar presentation, Herbs and Nutrients for Combating Metabolic Syndrome. My name is Tennille Newton and I'll be presenting this exciting and innovative technical webinar. This presentation is of a technical nature and is designed for the education of qualified healthcare professionals and practitioners. Metabolic syndrome is a significant public health issue and a growing epidemic. Almost 3 million Australian adults are affected by the condition, with this number likely to increase concurrently with the increases of obesity and type 2 diabetes. The incidence of metabolic syndrome is now at least 1 in 5 adults. Metabolic syndrome combines many risk factors that are in themselves significant public health issues, including cardiovascular disease, type 2 diabetes, dyslipidemia and hypertension. Data from the Australian Bureau of Statistics shows that greater than 62% of the adult population of Australia are classified as overweight or obese. Also, almost 2 million are affected with diabetes, and of this number, approximately 90% of cases are type 2 diabetes, and also nearly 4 million adults have cardiovascular diseases. Metabolic syndrome is defined by the International Diabetes Federation as having central obesity consisting of a weight measurement of equal to or greater than 90 centimetres for males of Asian ethnicity, equal to or greater than 94 centimetres for Caucasian or Arabic males, and equal to or greater than 80 centimetres in females. This central obesity presents in combination with any two of the following risk factor measurements: serum triglycerides of 150 milligrams per decilitre, HDL cholesterol levels lower than 40 milligrams per decilitre in men and 50 milligrams per decilitre in women, elevated blood pressure of systolic equal to or greater than 130 or diastolic equal or greater than 85. Finally, fasting plasma glucose measurements equal to or greater than 100 milligrams per decilitre. These factors, in combination with the central obesity that is common in men, postmenopausal women and android body types, significantly increase the risk of development of cardiovascular and abnormal glucose pathologies. The risk of heart attack or stroke is increased threefold in those with metabolic syndrome, and they also have a 5 times greater risk of developing type 2 diabetes than do healthy individuals. The primary treatment of metabolic syndrome needs to focus on quickly and effectively reducing the risk factors that contribute to the development of cardiovascular disease and type 2 diabetes. Dietary and lifestyle modifications are essential, and their importance should be stressed to the patient. The first goal is the loss of 5 to 10% of body weight. This will require a combination of both diet and exercise. A low carbohydrate or Mediterranean diet is recommended, as these will both effectively reduce total caloric intake, help stabilise blood sugar levels and support cardiovascular health. Regular exercise is necessary. 30 to 60 minutes of moderate intensity exercise is required most days of the week. If needed, refer the client to local fitness centres or fitness professionals for a tailored exercise program. As metabolic syndrome can seriously negatively impact cardiovascular function and glucose metabolism, it is important to have these parameters regularly screened by their medical practitioner. If the patient smokes or consumes excessive amounts of alcohol, these should be minimised or eliminated if possible. Secondary treatment of metabolic syndrome needs to manage the specific metabolic abnormalities and protect against degeneration of the condition. Atherogenic dyslipidemia can result in the development of atherosclerosis, degeneration of the cardiovascular system and disease. Bitter melon has shown to be effective in modifying blood lipids. Also, biotin, zinc, omega-3 fish oil, probiotics and antioxidants should be prescribed. I would encourage the client to drink a few cups of high-quality green tea each day, and garlic can be included in meals. Hypertension is a significant risk factor for cerebrovascular disease and heart attack. Antioxidant nutrients, including coenzyme Q10 and vitamin E, both protect the cardiovascular system and reduce high blood pressure. Both magnesium and omega-3 fish oils are also beneficial in the treatment of hypertension as well. Modifying the alterations in blood glucose metabolism are essential, including reducing elevated blood glucose levels and improving insulin resistance. Green coffee modifies glucose metabolism in a variety of ways. Bitter melon and the nutrients chromium, magnesium, zinc and biotin are essential for proper insulin receptor function and signalling pathways. In recent years, green coffee has been identified as an effective treatment for the pathologies associated with metabolic syndrome. Green coffee is a rich source of antioxidant phytochemicals. These include polyphenols, chlorogenic acid, and phytic acid that have shown to improve glucose metabolism. These phytochemicals have proven to be highly bioavailable. After ingestion of green coffee extract, 6 major types of chlorogenic acid were identified in the plasma. Green coffee extract positively impacts cardiovascular and stress-related pathologies that are associated with metabolic syndrome. A 2009 human trial using green coffee extract for 2 weeks found reduced blood pressure, serum triglycerides, urinary cortisol, and cortisone excretion. This sequence of diagrams demonstrates the effects of green coffee extract and chlorogenic acid on the various factors of glucose metabolism. In this diagram, the number 1 indicates chlorogenic acid's ability to reduce intestinal absorption of glucose. By reducing intestinal glucose absorption, insulin secretion is reduced and lipolysis is promoted as a source of usable energy. At number 2, we see the ability of chlorogenic acid to inhibit the enzyme glucose 6-phosphatase. This enzyme is critical for the final reaction in gluconeogenesis and glycogenolysis, primarily in the liver. In vitro research has found that chlorogenic acid inhibits this enzyme, reducing glucose production, decreasing blood glucose, and increasing the liberation and breakdown of triglycerides from adipose tissue. Again, it is through the inhibition of glucose 6-phosphatase that hepatic release of glucose is limited. This is seen at number 3. This beneficially impacts blood glucose levels, stabilizing blood glucose and reducing hyperglycemic peaks. Number 4 demonstrates the effect of green coffee extract and chlorogenic acid have on encouraging the release of triglycerides and free fatty acids from adipose tissue. This is achieved via reducing blood glucose levels, which encourages the use of stored fats as an energy source. At number 5, we see the effect of chlorogenic acid on the hormones that modify blood glucose levels. Glucagon is increased, stimulating the release of stored glycogen for conversion to usable energy. Excess insulin release is decreased, reducing stored glucose and glycogen. Adipose tissue releases stored triglycerides and free fatty acids to be used as an energy source in response to decreased blood sugar levels and the modification to both glucagon and insulin secretion. The final stage, seen at number 7, is the ability of green coffee extract and chlorogenic acid to encourage the use of free fatty acids by the muscles as a source of energy for ATP production. This increases fat burning and facilitates weight loss. A small human trial involving 50 participants with a BMI greater than 25 took green coffee extract for 60 days and reported improved BMI, muscular to fat mass ratio, and an average weight loss of 5 kilograms. The herb bitter melon has been historically used in traditional Chinese medicine for the treatment of diabetes. Bitter melon has been shown to reduce hyperglycemia via increasing hepatic glucose utilization and storage. This is achieved via decreasing gluconeogenesis due to the inhibition of glucose 6-phosphatase and fructose 1,6-biphosphatase by bitter melon. Bitter melon also improves the oxidation and cellular uptake of glucose via activation of glucose 6-phosphate dehydrogenase. Research has also demonstrated the ability of bitter melon to promote the release of insulin and potentiate its action. Bitter melon was found to increase the number of insulin-producing beta cells in the pancreas in vivo trials. Subjects also had improved insulin sensitivity in fructose-induced insulin resistance. In diabetic subjects, bitter melon also positively impacted cholesterol, phospholipids, and triglycerides. This may have additional benefits for patients with metabolic syndrome. Recently, research has discovered positive effects of bitter melon on adipose tissue. It was found to inhibit lipogenesis and stimulate lipolysis in adipocytes. Additionally, adipocytokines, peroxisome proliferator-associated receptor, resistin and perilipin mRNA expression were also reduced in adipocytes and preadipocytes. The author of this study suggests that bitter melon may prove to be a potent therapy to reduce adipogenesis in humans. Considering that over 62% of adult Australians are now overweight or obese, bitter melon may be a key herb in the management of this health epidemic. Adiponectin is a hormone that is secreted exclusively by adipose tissue. It is anti-inflammatory, cardioprotective, and modifies the body's response to insulin. Those with insulin resistance and also obesity have been found to have low levels of adiponectin. Bitter melon increased adiponectin secretion by adipocytes by 75% compared to controls, and also increased GLUT4 in skeletal muscle and adiponectin levels in fructose-induced hypoadiponectinemia. It is now well established that chromium is an important mineral for blood glucose metabolism. It facilitates insulin signaling and improves systemic insulin sensitivity. Low levels of this nutrient are associated with type 2 diabetes. Supplementation with chromium picolinate reduces insulin resistance and the risk of cardiovascular disease and type 2 diabetes. Some other nutrients that are particularly important for blood glucose metabolism are magnesium, vitamin C, zinc and biotin. Low levels of magnesium, zinc and biotin are associated with the development of type 2 diabetes. They are synergistic and support healthy glucose metabolism and lipid parameters. The treatment of metabolic syndrome needs to incorporate the dietary and lifestyle modification mentioned earlier in the presentation to achieve weight loss, improve blood glucose control and increase cardiovascular health. This is supported by the use of a formula containing green coffee, bitter melon, chromium and nutritional cofactors. One tablet taken twice daily can help to normalise blood glucose metabolism, positively influence serum lipid profile and facilitate weight loss. Coenzyme Q10, one capsule daily, providing 150 mg of CoQ10, is essential for its myriad of benefits to the cardiovascular system. CoQ10 is cardioprotective, beneficial for hypertension and supports cellular energy production. Many patients with metabolic syndrome will be on prescribed statin medications to modify their cholesterol, and coenzyme Q10 can be used concurrently to reduce the side effects of these medications. Omega-3 fish oil containing 400 mg of EPA and 200 mg of DHA should routinely be prescribed in metabolic syndrome. One capsule 3 times daily will help to protect the cardiovascular system, support weight loss and reduce systemic inflammation. Rhodiola in combination with Rehmannia, tyrosine and iodine provides herbal and nutritional support for stress, adrenal and thyroid function. Stress can significantly hinder weight loss and increase blood pressure and poor thyroid function. This reduces basal metabolic rate and leads to weight gain. Therefore, supporting the adrenals and thyroid is an important aspect of metabolic syndrome management. One tablet 3 times daily is recommended. Additional treatment may include the use of vitamin C with high-dose bioflavonoids, magnesium powder, antioxidant support and liver support formulas to address glycation, oxidative stress and support hepatic function. Thank you for watching this webinar. I invite you to visit the website www.nutrimedicine.com for further information. Here you can access additional technical resources and patient handouts. Please ensure you complete the questionnaire to qualify for your CPE points. We look forward to your feedback and further use of our educational webinar series.